Welcome! We are the other drugs that affects the anterior pituitary hormone. And I am Chorionic Gonadotropin. Well, that's my generic name. I am also called by my brand name, Corex, Navarro, Ovidril, Pregnil, and Profaci. Unfortunately, my chemical name is unavailable. Anyway, these are my friends, Menotropin and Thyrotropin Alfa. Hello, let me introduce myself. My generic name is Menotropin. My brand names are Pergonal, Menopor, Repronix, and Humigon. My chemical name is 6,6-dimethylheptanol. Good day. Allow me to introduce myself as well. My generic name is Thyrotropin Alfa. My brand name is Thyrogen. My chemical name is C975H1513N267O304S26. Wow, Thyrogen, you have a cool chemical name. Thank you. You have cool names as well. What is your drug classification? My therapeutic drug classification is spermatogenesis and ovulation stimulant. My pharmacologic drug classification is gonadotropin. Whoa, really? Because those are my drug classifications as well. Really? What about you, Thyrogen? What is your drug classification? My therapeutic drug classification is diagnostic aid similar to TSH, while my pharmacologic drug classification is anterior pituitary hormone. Oh, too bad. We're not the same. What about you, Chorionic Gonadotropin? Do we have the same pregnancy category? Oh, I don't know, but my pregnancy category is X, which means that my risks involved in pregnant women clearly outweigh potential benefits. Wow, my pregnancy category is also X. I wonder, what else do we have in common? Well, let's find out later. What about you, Thyrogen? What is your pregnancy category? My pregnancy category is C, which means that animal reproduction studies have shown an adverse effect on the fetus, and there are no adequate and well-controlled studies in humans. But potential benefits may warrant use of the drug in pregnant women despite potential risks. That's awesome, Thyrogen. Now, let me tell you about my mechanism of action. As an ovulation stimulant, I mimic the action of luteinizing hormone in stimulating ovulation of mature ovarian follicle. As a spermatogenesis stimulant, I stimulate androgen production in Leydig cells of testes and causes maturations of cells lining the seminiferous tubules of testes. As for my pharmacokinetics, in my absorption, I am administered intramuscularly. I cause blood levels to peak within 6 hours. As for my distribution, I am distributed primarily into testes and ovaries. For my metabolism, I have an initial half-life of 11 hours with a terminal phase of 23 hours. For my excretion, I am excreted in the urine. What about you, Menotropin? What is your mechanism of action and pharmacokinetics? Do you think we're the same? Oh, my mechanism of action is that I mimic luteinizing hormone and follicle-stimulating hormone. My pharmacokinetics, on the other hand, is very different from yours. Allow me to explain my pharmacokinetics. My pharmacokinetics. For my absorption, I am administered subcutaneously and intramuscularly, with bioavailability of 76% for follicle-stimulating hormone and still unknown for luteinizing hormone. My distribution and metabolism are unfortunately both unknown. As for my excretion, I am excreted by the kidneys. And those are my mechanism of action and pharmacokinetics. What about you, Thyrogen? Yeah, hi. My mechanism of action is that I bind to the thyrotropin receptors found on any residual thyroid cells or tissues. This stimulates radioactive iodine uptake for better radiodiagnostic imaging. As for my pharmacokinetics, for my absorption, I am administered intramuscularly. For my distribution and metabolism, it is unfortunately both unknown. For my excretion, I am excreted in the urine. That is all for my mechanism of action and pharmacokinetics. Allow me to proceed to my indications and contraindications, starting with my indications. I am indicated to keep your thyroid-stimulating hormone levels steady while you undergo the thyroid tests or treatments that can reduce thyroid-stimulating hormone and cause symptoms of low thyroid or hypothyroidism, and for detection of residual or recurrent thyroid cancer. As for my contraindications, I am contraindicated to be used with untreated deficient secretion of pituitary hormones, allergies, and spread of cancer to the brain. Those are from my indications and contraindications. What about you, Menotropin? What are your indications and contraindications? I am indicated to be used for stimulation of spermatogenesis and production of follicular maturation. As for my contraindications, I am contraindicated to be used with high follicle-stimulating hormone level indicating primary ovarian failure, uncontrolled thyroid, and adrenal dysfunction. What about you, Chorionic Gonadotropin? Interested in sharing your indications and contraindications? Of course, count me in. For my indications, I am associated with the following conditions: male hypogonadism and prepubertal cryptorchidism. I may be repeated if unsuccessful in 1 month for prepubertal cryptorchidism. I am also associated with the following therapy: ovulation induction therapy, which induces ovulation and promote pregnancy, and stimulation of spermatogenesis therapy. Let's go to my contraindications. I am contraindicated in patients hypersensitive to human chorionic gonadotropin, and in those with precocious puberty or androgen-responsive cancer, because drug stimulates androgen production. Use cautiously in patients with asthma, seizure disorders, migraines, or cardiac or renal disease, because it may worsen these conditions. It is still me, Chorionic Gonadotropin. Now let's talk about my side and adverse effects, starting with my side and adverse effects on the central nervous system. These are headache, fatigue, irritability, restlessness, and depression. For the cardiovascular system, we have edema. For genitourinary, we have early puberty, associated with growth of testes, penis, pubic and axillary hair, voice change, and growth of body hair. Another side effect in the genitourinary is the hyperstimulation or ovarian enlargement. And we also have rupture of ovarian cysts. Menotropin, mind sharing your side and adverse effects to us? Sure, let's start with my side and adverse effects on the central nervous system. My side and adverse effects on the central nervous system includes malaise, headache, cerebral vascular accidents, dizziness, and fever. For the cardiovascular system, we have tachycardia. In the gastrointestinal system, we have bloating, diarrhea, abdominal cramps, nausea, and vomiting. For the genitourinary, we have hyperstimulation syndrome, ovarian enlargement, ovarian cyst, and ectopic pregnancy. For the musculoskeletal, we have joint pains and muscle aches. For the respiratory system, we have arterial occlusion, dyspnea, tachypnea, pulmonary embolism, atelectasis, and acute respiratory syndrome. Other side and adverse effects include rash, gynecomastia, multiple births, hypersensitivity reactions, anaphylaxis, and chills. My turn! My side and adverse effects are fatigue, headache, dizziness, and fever, flushing, diarrhea, nausea, vomiting, overactive thyroid gland, joint pains and muscle pain, bronchospasm and wheezing, rash and hypersensitivity reactions. Let's proceed to my nursing responsibilities. Visually inspect parenteral products for particulate matter and discoloration prior to administration whenever solution and container permit. Consider pre-treatment with glucocorticoids for patients in whom tumor expansion may compromise vital anatomic structures. Routine measurement of thyroid-stimulating hormone concentrations is not recommended after Thyrotropin Alfa use. Discard product if it contains particulate matter, is cloudy, or discolored. Protect from light. Reconstituted product should be refrigerated and used within 24 hours if not used immediately. Store between 35 to 46 degrees Fahrenheit. Thank you, Thyrogen. Now it's my turn. This is Menotropin, by the way, and here are my nursing responsibilities. Pregnancies that follow ovulation induced with menotropins show a relatively high frequency of multiple births. Give drug only by intramuscular route. Reconstitute drug with 1 to 2 ml of sterile saline injection. Use immediately and discard any unused portion. Store drug at 37 degree to 86 degree Fahrenheit or 3 degree to 30 degrees Celsius. Monitor patient at least every other day for enlarged ovaries or hyperstimulation syndrome during and for 2 weeks after therapy. Drug isn't indicated for use in breastfeeding women. What about you, Chorionic Gonadotropin? Any nursing responsibilities to share? Yes, I do. My nursing responsibilities are: only clinicians experienced in treating infertility disorders should administer drug. Pregnancies that occur after stimulation of ovulation with gonadotropins show a relatively high risk of multiple births. HCG is usually used only after failure of clomiphene in anovulatory patient. In infertility, encourage daily intercourse from day before HCG is given until ovulation occurs. Be alert to symptoms of ectopic pregnancy, usually evident between 8 and 12 weeks gestation. May interfere with radioimmunoassays for gonadotropins. Carefully observe young men receiving HCG for development of precocious puberty. Carefully monitor patients with disorders that may be aggravated by fluid retention. It isn't known whether chronic gonadotropins appear in breast milk. Use caution when giving to breastfeeding women. Treating pre-pubertal cryptorchidism with ACG can help predict future need for orchidopexy. Induction of androgen secretion may induce precocious puberty in patients treated for cryptorchidism. Instruct parent to report the following: axillary, facial, or pubic hair, penile growth, acne, or deepening of voice. Teach patient and family how to assess for edema and urge them to report it promptly. Advise patient and family to report signs of precocious puberty promptly. Inform patients receiving HCG for infertility that multiple births are possible. So that's us. We still have 2 more friends who would like to introduce themselves to you. So please stay a little longer. Thank you.
Behold, we are the other drugs that affect anterior pituitary hormones.
Hello, my generic name is Corticotropin, and that image is my brand name, Acthar. My chemical name is this.
My therapeutic drug classification is diagnostic aid and a replacement hormone. As for my pharmacologic drug classification, I am an anterior pituitary hormone.
Now you've learned my drug classifications, let's proceed to my pregnancy risk category. I am categorized in C, which means studies have shown an adverse effect to the fetus. Moving on to my mechanism of action. As a diagnostic aid, I combine with a specific receptor on the adrenal cell plasma membrane, and I stimulate the initial reaction involved in the synthesis of adrenal steroids, including cortisol, cortisone, weak androgenic substances, and a limited quantity of aldosterone. Also, I have an anti-inflammatory action, which I stimulate release of adrenal cortex hormones,
which combat tissue responses to inflammatory processes. Now, let's head on to my pharmacokinetics. I am absorbed rapidly after intramuscular administration. As for my distribution and metabolism, it is still unknown today. For my excretion, I am excreted by the kidneys and have a 15 minutes half-life. That's for my pharmacokinetics. Now, let's explore to where I am indicated. I am used to treat symptomatic sarcoidosis, gouty arthritis, systemic lupus erythematosus, serum sickness, polymyositis, optic neuritis, nephrotic syndrome, infantile spasm, and choroiditis. On the contrary, I am contraindicated in patients with peptic ulcer, scleroderma, osteoporosis, systemic fungal infections, ocular herpes simplex, peptic ulceration, heart failure, hypertension, sensitivity to pork and pork products, adrenocortical hyperfunction, or primary insufficiency or Cushing syndrome, and in those who have had recent surgery. Let's explore the side and adverse effects to each body system. First, for central nervous system, I may cause seizures, dizziness, vertigo, and increased intracranial pressure. In a cardiovascular system, I may cause hypertension, heart failure, necrotizing vasculitis, and shock. For the gastrointestinal, I may cause peptic ulceration, pancreatitis, abdominal distension, ulcerative esophagitis, nausea, vomiting, and increased serum amylase level. For the musculoskeletal system, I may cause muscle weakness, steroid myopathy, loss of muscle mass, suppression of growth in children, and osteoporosis. To the respiratory system, I may cause pneumonia. In the skin, I may cause impaired wound healing, acne, and hirsutism. Now let's learn the special considerations to be taken after administering me. I may mask signs of chronic disease and decreased host resistance and ability to localize infection. If I am administered in a gel form, I must be warm to room temperature and drawn into a large needle and given slowly. Deep intramuscular, and the nurse must monitor weight, fluid exchange, and resting blood pressure levels until minimal effective dosage is achieved. Lastly, if I am suddenly stopped, I may cause severe adverse reactions. And that's all for Corticotropin. Now, it's my turn. I have a generic name of Cosyntropin. Cortrosyn is my brand name. And this is my chemical name. Next is my drug classification. For my therapeutic drug classification, I am a diagnostic 8. For pharmacologic drug classification, I am an anterior pituitary hormone. As for my pregnancy risk category, I belong to category C, the same as to Corticotropin. Moving on to my mechanism of action, I bind with a specific receptor in the adrenal cell plasma membrane to begin synthesis of its entire spectrum of hormones, one of which is cortisol. Now, let's proceed to my pharmacokinetics. First is my absorption. After intramuscular administration, I am absorbed rapidly in a GI tract. Then, for my distribution, I am removed rapidly from the plasma by many tissues, so it is not fully understood yet. And my metabolism is still unknown. Lastly, I am excreted by the kidneys. And I am intended for use as a diagnostic drug of adrenocortical function. but contraindicated in patients who have hypersensitivity to me. Also, I'm contraindicated in using together with blood and plasma products as I inactivate Cosyntropin. Now you have learned my indications and contraindications, let's head on to my side and adverse effects. To the central nervous system, I may cause dizziness, seizures, vertigo, and increased intracranial pressure. To the cardiovascular system, I may cause flushing. To the gastrointestinal, I may cause peptic ulcer, pancreatitis, abdominal distension, ulcerative esophagitis, nausea, and vomiting. To the reproductive system, to women, I may cause menstrual irregularities. To the musculoskeletal system, I may cause muscle weakness, fractures, steroid myopathy, loss of muscle mass, osteoporosis, and vertebral compression. In the integumentary system, I may cause impaired wound healing, fragile skin, diaphoresis, acne, hyperpigmentation, and hirsutism.
Here are the special considerations. I am less antigenic than corticotropin and less likely to produce allergic reactions.
Then the nurse must inform the patient taking spironolactone, cortisone, hydrocortisone, or estrogen that I may interfere with test results. Lastly, for rapid screening, plasma cortisol levels should be determined before and 30 minutes after administration of either intramuscular or intravenous injection. We both thank you for listening to our story.